Thank you very much for your time. Perfect timing. I know from all of this experience, it's not easy to get all that you all have to say
Had a lot to say.
into a short period of time. So, Mr. Joyce, do you have any questions?
Well, thank you. I appreciate all of you coming today, and I certainly heard my background. I certainly appreciate that justice costs money, and we need to put the money into it. I do want to follow up with Chairman Bordeaux. Not necessarily on point, but following up on Ambassador Dana's thing about healthcare being part of the process for all this. Your hospital on the reservation had some issues about accreditation. How is that getting any better for you?
It's an annual thing. CMS comes and one part of the hospital gets better. The emergency now room has gotten a lot better, but the funding level is it's just terrible. We just can't get any doctors. I mean, tracking doctors to the Rosebud Reservation is pretty remote in terms of the other tribes in South Dakota. But yeah, we're coming up for another review here this year, and we're getting ready for that. So the ER part of it is pretty bad, though. Yeah.
Well, good luck on that issue. I have no further questions. You go back.
Chairwoman McCollum.
You were very humble in introducing yourself. I want to thank you for your infantry service to our country. And when you were speaking about being on the roadside and helping someone, you're a lab technician, which means that you've spent a little time around the medical arena. They were very fortunate to have you as a person by the roadside. I did a little looking at what EMTs, EMSs get paid, and I'm going to slide this over and you can show it to folks, but you're surrounded by states. Minnesota pays the highest, Nebraska pays the second, then Iowa and North Dakota, and even Wyoming. It's only Montana that touches your border that pays the same, and this isn't the tribal wage. This is just the average public wage. If we don't get the wages right, we can't keep recruitment. But if you don't have the safe roads to drive on and the equipment, and as Rosebud had in their testimony, 3 ambulances the size of Rhode Island, one's probably doing transport. Right. So 2 ambulances. So people are waiting for ambulances. The stress that those people have gone into this field to help, whether it's law enforcement, victim advocacy, the stress that these individuals are dealing with is phenomenal. And we are truly fortunate to have people in Indian country that wake up every day and do these jobs. But I'm just going to share this with you. We are going to, when we have discussions with the Bureau of Indian Affairs and others that touch the financing on here, they also need to be advocating for you because they work for you. So with that, I'm profoundly grateful for your testimony, and with that, I yield back.
Thank you, Mr. Kilmer.
Thank you, Madam Chair. I just want to express gratitude to each of you for coming and testifying and sharing your stories. I particularly am grateful for continuing to highlight the murdered and missing Indigenous women and girls. We heard some testimony on that yesterday. I just think it's horrific, and I think we have to both shine a greater spotlight on it, make sure that those who are working in this arena have the data and the resources and hopefully the solutions that they need to address it. So thank you for shining a light on it.
Thank you. Thank you to all of you for your testimony. I echo what my colleagues have already said, and we're very pleased to have someone here from my home state. We're very proud of our tribes, and of some of the innovative work you've been doing, that the tribe has been doing, given such limited resources that you all, really struggle with. So thank you for doing that. I had a chance to talk with you a little bit yesterday and other tribal members, and I was really impressed by some of the work you discussed about both dealing with the family trauma, which is, such a big issue, and helping kids. And one of the things that was brought up was that while there is some funding once people, need the treatment, how do we do more prevention work? And can you talk a little bit about some of the interesting work that's being done in the community and in the schools?
Yeah, thank you so much for your question. So we do get the SAMHSA funding, and that goes into our healthcare systems and the individuals already in treatment. And we have a youth program that you met some of our council people yesterday that work in that program. And we've really been able to incorporate a lot of cultural practices. We've received grants to build birch bark canoes, and our people are historically canoers. We've competed in the Indigenous Games many times. So we're finding if we can get to children as a preventative tool in this whole crisis and give them things to do. I heard a statistic recently that the most dangerous hours of the day for children are between 3 and 6. So getting them after school before dinner time and when they may be unsupervised. And we have really great programs, but it's very, very hard to identify sources of support for those programs. So I really think that if we take an approach that we want to get these kids before they're turning to drugs and alcohol, that's where a lot of our focus needs to be.
Mm. I'm really appreciative of how the tribe comes together as a community and uses traditions from the community to engage people at all levels. And, of course, we're always very proud of birch bark canoes in the state of Maine.
Absolutely.
Secondly, just quickly, because I know sometimes it's harder for my colleagues to understand the real challenges that Maine tribes face because of the Indian land claim settlement. And we talked a little bit about VAWA and how important that is, particularly in many of the issues we've already talked about here, but how, that happens in Maine because of the land claim settlement and issues that we're constantly trying to figure out how to resolve. Mm-hmm.
Yeah, so that's incredibly timely because I believe VAWA hearings are happening as we speak or very, very soon. And we're a tribe that has a settlement agreement with the state, and it's really, we maintain that we never gave up our sovereign rights to be a federally recognized Indian tribe, but it's really impeded a lot on our access to federal acts and to be covered underneath them. And unfortunately, VAWA is one that we've been excluded from. So as we move forward, we really need to be identified in some way in that legislation. We have, our biggest issue is that we need to be able to prosecute non-native offenders on the reservation in our tribal court. We have 91 cases right now in our domestic violence program, and a lot of women don't want to move forward with their cases on their perpetrators because going through the state courts and we have very little success there, it's kind of re-victimizing them all over again. So VAWA protections are critically important for our tribe.
Great. Well, thank you to everyone on the panel, and I yield back to the chair.
Mr. Kilmer, are you going to be here for the next panel? Would you like to introduce them?
It's okay. I have to step out.
I have to step out shortly after Ms. Lawrence comes as well. So I would like the next. Thank you so much. Thank you so much.
Very much to all of you. Thank you.
You're doing good things too, so it's not just. Cheryl Kennedy, Confederate Tribes of Grand Ronde Community of Oregon. Rick Peterson, Chairman of the Red Cliff Band of the Superior Chippewa. David Z. Bean, Vice Chair, Pulapet Tribe. And President Jefferson Keel, National Congress of American Indians. Welcome to all of you.
I'm sorry, I got to go to my other committee.
Yeah, Brenda's
pesky other committees.
We're going to submit some additional testimony in from the Honorable Jillian Bear Runner. And without any objection? Thank you. So to this panel, one of my colleagues should be coming in to switch with me if she's able to. I mean, no disrespect by stepping out. These have been a fascinating day and a half. I have this afternoon to go, and everything is very impactful that you're sharing with us to help us do a better job. And I'm waiting for the door to close so that we can hear you. Okay. So, Ms. Kennedy, if you would please lead this panel off, welcome.